session of Ask the Doctors. Good evening. My name is Dr. Frederick Unubohai. I'm a licensed medical doctor. People call me Dr. Fredostar. And I always tell you good life in a sense. Now, on this program, we teach, we educate, but we know they give medicine. We know they make diagnosis. This program holds every Sunday by 8 p.m. Nigerian time. 8 p.m. to 9 p.m. Nigerian time. I be the host of the program, and my co-host now Dr. Israel Robonose. Now on today's program, we they do question and answer. No, don't worry. Don't worry. Don't worry. We are all here together. Uh-huh. What's in the apple? Uh-huh. Okay. Oh yeah now. So anybody will get question for me, Drop your que- drop your question in the comment section. Okay, Dr. Israel is in the house. Okay, Israel, if you are ready, just give me thumbs up. Okay. Let me bring up Dr. Israel. Dr. Israel, good evening. How you doing? Hello.
Hello, good evening. Happy Sunday.
Yes, I'll call you tomorrow, but they don't start their program. I just sit in home now.
Hey, oh yeah now. Alpha, Dr. Israel, how you doing? I'm on this network, yeah? Network, okay. Okay, so anybody will get question for us this night, ask us, I beg. Ask us. Hello. Hey, wait, God, I beg. Oh. Who be this? This network now, wow. Okay. Hmm. Ada Obi Jacinta, Friday Obiora, Victoria, I see you. Stella, I see you. Michael, Judy. So if you get question now, I beg put some for the comment section because if you dey ask us question when we don't finish, we no go fit answer you. If they ask for number, I want to call you. Sorry, oh, we know they give number online. We know they do private chats. Do you understand? We know they do private chats. So if na that one you dey find, no, no, we no go answer that one at all, at all. Okay. What is the best remedy? What is the best remedy for tooth pain? Wetin be your name? Your name na Elijah Biodu. The best remedy for tooth pain now, number one, waiting they cause your tooth pain. Because there are many things that can cause tooth pain. If it be from the gum, na the gum. If it be from the tooth itself, maybe the tooth get hole. If it be say the person get infection inside the mouth. Do you understand? So you need to first of all know wetin dey cause the tooth pain. Na something wey dey come every time, every time, every time. Even na something wey go do you go do you go. They go need to check your tooth or your teeth as the case may be. Come decide if you go need antibiotics, if you go need washing of that tooth, if you go need for them to comot am or for them to fill am. So there are different ways you go manage person wey get tooth pain, and that one you go need to see a dentist so that make a dentist make he answer you. Are we together? Because most times you go just take pain relief, the pain go just come, go come, go, but that is not a lasting solution to your tooth pain. So somebody go need to check your tooth, Mr. Elijah, and find out wetin dey cause the problem for inside the tooth, and then they will come treat you. What please, what will help me from pimples? How are you sure say wetin you get na pimples? Because pimples fit be because of stress. Wetin be your name? Junior. Now listen carefully. Some people they get pimples because of stress. Some other people they get pimples because of hormonal changes. Some other people they get pimples because of cholesterol issues. Some other people they get pimples because of issues with their skin around the face. Some now because of puberty. You know, when a boy or a girl don't they grow, you get how you go reach one certain level, you can't enter puberty, hormone will come change, you can't they get pimples for the face. Everybody will come they shout, go and use this, go and. So there are different things where they cause pimples. So for your own, waiting they cause your own right now. We need to be sure. So the only advice I will give to you online, because this is not a hospital, and we know they consult for here, because this not be hospital and we know they consult. So, and the only advice I will give to you, if your pimples now waiting just starts, it just starts. Let me say they do you, it just starts. Number one, try to wash your face frequently. Don't apply anything. Wash your face, because if you wash your face frequently, all these holes for your skin, you go comot the oil, so your face go dey free. The oil go come outside. After a while, the pimples will disappear. That is number one. So try to wash your face frequently. Number two, if you dey severely stressed, take more fruits and try to rest. Your pimples go also disappear, because pimples for some people, when they are very stressed, they get pimples. These are the two advice I will give you online. The other one, you go need to enter hospital, make them check you. You understand? Okay, this person says, okay, before I take this question from Boniface Ibrahim, builder Boniface, everybody share this life. Everybody share this life, because you cannot be asking questions and you know they share the life. It means say you know they support me. Oh yeah, let's go, let's go. Everybody share, share, share. I'm waiting for you. Hmm? When you share, just comment I don't share, because I dey check am for here. Let me see how many of you don't share. Oh yeah, oh yeah, oh yeah, share. I'm waiting for you. Share now. Let me look for the people we don't share. Let me look for their names. Maybe now, so we go to do them now. Those we share, we go just they answer them. Let's do like that. Because human beings sometimes they can use you. They go use you, they no go support you. Okay, so people are sharing. Very good. Now, Builder Boniface says, anytime I take my baths, my body always scratches me. What is the remedy? Now, let's get something clear here. When you are asking for remedy, be rest assured that here I no go treat you here. Here no be hospital. Let's be clear. So in case you dey find me to dey give medicine online, let's be on the same page. There are many reasons why people skin fit dey scratch them after they take their baths. Number one, maybe you dey use cold water. So we go advise you try to use warm water. Number two, we go advise you try not to use sponge for some time. Try to use only soap. Number three, we will advise you say when you take your bath, try to use baby oil immediately after you take your bath. Number four, some people go say make you add a little soda inside the water to help you. And then if you don't try all these things, e not still dey work, then you go need to go hospital make them give you some medications to help you. But if you try one or two of these, now I don't do video. The video dey YouTube. I listed plenty things. You can watch it there too, so that it will help you. But this one, these little things what I mentioned, fit also help you. Let's see. I have used so many remedy, but not working. Then enter hospital, please. Junior, your name is waiting. Junior, love Jessica. Love Jessica. Good evening. I see you. Welcome. Junior say I have used so many remedy, but not working. Then I go advise you make you enter hospital, and see a doctor, or see a dermatologist. Make it help you. Do you understand? Theodora is asking us a question here. He say, "Good evening. Please, what is the cause of anticoagulants?" Theodora Tamuno Tonye, your question is totally confused. I'm not trying to mock you, but make I no lie you. Wetin you ask, you don't know wetin you dey ask. So try to re-ask your question correctly. Please try to ask your question correctly, because this question wey you ask, so you just be like, I don't know how to describe am. You just scatter the thing. So what exactly do you want to ask? Because wetin you dey ask for here, so you no know wetin you dey ask. So make it as simple as ABC. Clearly, wetin you want make I explain for you. Ask am. Don't ask what is the cause of anticoagulant, because this anticoagulant is beyond you. Anticoagulant is beyond you on this live session. So make your questions clearly. Wetin you want ask. Because people go come online, they go want use big grammar. So make your questions very simple. I know they yabi o. But what I'm saying is that wetin they ask, you know really get them correctly. So rephrase your question and ask me well, which you want ask me. Okay. Okay, I have many questions here, but if you just they come, share this live. We have Dr. Israel in the house. Network they show Dr. Israel Shege since, but let's bring him back up. Dr. Israel, how far? You hear me now?
Yes, I dey hear you. Good evening. Happy Sunday.
Yeah. Good evening. Welcome. Okay, so I have been taking some questions. Let's go to the next one. Good evening. What is the cause of chest pain, nose congestion, and frequent belching? Dr. Israel, you want comment on this one?
No.
Okay. My guy, your name now Bright words, Bright Admore. See, listen carefully. Please listen carefully, Mr. Bright. When you say what is the cause of chest pain, there are over 50 stuffs that can cause you chest pain, or more. 50 stuffs can cause more than 50 stuffs can cause chest pain. What can cause nose congestion? Maybe na allergy, maybe na weather, maybe na stress. And when you get frequent belching, that is different. So we cannot confidently tell you why you dey get chest pain on this Facebook live, because chest pain can be because of muscle, can be because of the lungs, can be because of the ribs, can be because of the heart, can be because of mental issue, can be because of stress, psychosomatic disorders. It can be referred pain. It can be because of your job. Sure, you understand? Or because of trauma. So there are many things which will give you chest pain. And we no go fit tell you say if you get chest pain, now this one cause am because we need more information from you. But wetin I go advise you on this live session right now be say if you dey get chest pain, and you notice say this chest pain, whenever you breathe in, you breathe, it dey pain you. Whenever you cough, it dey pain you. Or whenever you carry anything, you do anything, it dey pain you. Carry your body enter hospital. But if you know say this chest pain, it just comes small, e come disappear. E just start few days ago. I go say make you watch am first, little. But if the pain can't continue, e no dey disappear, run enter hospital because some chest pain can be life threatening. If it dey threaten the person life. So we know one day on this live session and tell you say na nothing, whereas na severe problem. Uh-huh. Okay. The questions for here are plenty, oh Jesus, and they are not sharing the live. So these people are not sharing. Let me see if I can see the questions again. Voila. God, I beg you. The questions are plenty. Make I try. See, oh yeah, everybody share, 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 share. Let me see. Okay, this one says, good evening. There was this your video, I think, about STD. And somewhere along the line, you noted that staphylococcus is not an STD. I'm confused. Was this a mistake? Because I don't understand that. DJ waiting, DJ X5. Okay, look at my lips. Look at my face. Staphylococcus is not a sexually transmitted disease. It is not a mistake. They don't too deceive our people, especially some quacks and some criminals out there on the streets. They don't come online when they want sell nonsense to you in the market in the streets. They will tell you say staphylococcus is a sexually transmitted disease. So staphylococcus is not a sexually transmitted disease, and it was not a mistake. I don't do video about them. I don't explain. Most times, people go tell you, say, I get staphylococcus. Huh? I get staph. You go ask them, how do you take know say you get staph? They go say, I just go lab. No, not lie. Carry your body, go see doctor. If true, you get a condition where staphylococcus cause, your doctor go treat you. But this whole idea where everybody go just wake up, I get staph, I get staph, I get staph, that they use and chop you. So it was not a mistake, my guy. It was very clear. Staphylococcus is not a sexually transmitted disease. Dr. Israel, you hear me?
Yes.
Okay. So we have a question here. It says, I've been facing back pain for like 3 years now, and it's also affecting my boobs and legs too. Hmm. Dr. Israel, what do you want to talk about this one?
Affecting my what?
It affects in bobby and in leg.
Okay. Um, waist. Okay, back pain. Now it depends on. For this person, I will advise that you go to the hospital. So if your back pain is already affecting your legs and it's affecting your chest area, I think you should go to the hospital because it may not just be what you think. Uh, Sometimes we know say activities when we dey do fit make all these things happen. But when e don dey the pain don dey move from one place of your body to other place, e fit be say e don dey affect your nerves and all that. So and if the nerve dey affected, e no dey sweet, not be good thing. So you need to go see your doctor. So what kind of work you do will still determine the kind of pain you have. Now another thing, when you say your back dey pain you, is it in which part of the back will still determine if we know how e take dey affect your chest area. Another thing is you dey lift heavy load. Another one na when you take dey eat, and all those so many other questions that you can be asked. You get anytime when you injure your back, when you hit your back for somewhere or not that. So we will need to ask all those questions, and those are what will help us to know how they go fit take diagnose whatever is actually happening to you. So that make I say the best thing to do is for you to go to the hospital so that this diagnosis can actually be made.
Okay, thank you so much, Dr. Israel. There is this question here. This question a very important one. This person say, please, what can one do when your typhoid develop antibiotics resistance? Wetin be your name? Your name na Nnemeka Enwelu. Now, make I no lie you, you no get typhoid. Nnemeka, you don't have typhoid. Because if you, Nnemeka, get typhoid, you no go fit sit down for this live session. They ask us about typhoid. Eh? Because most things where people they call typhoid, they go lab, they go test them. Ah, you get malaria and typhoid, you get malaria and typhoid. My brother, that is not typhoid. Because medically, patients where they get typhoid, they severely ill. So you don't have typhoid. Number two, who they tell you say your typhoid get antibiotic resistance? Because person where the typhoid don't get antibiotic resistance, now critical case. You not fit, listen, you not fit sit down, they do live session for Facebook if you truly get typhoid, say you get antibiotic resistance. So how did you even come across this my typhoid resistance? I don't know if Dr. Israel want to talk something about it. Dr. Israel, I beg, over to you.
Okay. The test when they normally they do for you guys, when the contact say you get typhoid, is not the correct test to use to diagnose typhoid. They'll do wider test. And make I tell you the fact is that anything can make wider test read high result, read high titer value. You can read 1/160, 1/80. So many things can cause it. Even the drug when you dey take for the for whatever you call typhoid, fit even make the titer value high. And if stress can also make the titer value high, malaria can, most things can make the titer value high. So because of that, we no dey use that wider test as a test to diagnose typhoid. So there are good tests to use. You use the blood culture, use your stool MCS. Those are wetin dem dey use take dey diagnose typhoid, because it's caused by a bacteria called Salmonella typhi. Until you see that Salmonella typhi, you no fit talk say you get typhoid. You dey get am. And as Dr. Fred say, talk, if you get typhoid, you no fit sit down for live session come type question, because you will be on a hospital bed. You'll be on a hospital bed. In fact, one of the time I saw typhoid fever, really, I told the nurse with me and I showed him. I showed her, I said, now this one be typhoid. And the nurse open mouth down. I said, I just see the way this patient they behave. Now this one be typhoid. So for all of now, when for you when think say you get typhoid because of they go do one test for you, wider test, and they use am take dey chop your money, you not get typhoid. You just only have malaria that you need to treat. And sometimes you fit still dey feel weak, go and relax, because the work when you dey do still too much. Relax, eat a lot of vegetable, drink a lot of water, chop fruit, you'll be fine. Okay, I don't know if una dey hear me. If you dey hear me, please just write on the session say you dey hear me, because I notice say Dr. Fred dey offline for the moment. So I don't know if we don take this question, but I dey see. Okay, that's just like a follow-up question. So if you still get question, just write am down so that we go try address am. And if you not ever share the live, please try and share the live session, so that that na the only way, one way when you go fit take support us. So as I said, if you dey hear me, please write on this, uh, write and say you dey hear me, so that and if you get question, abeg drop the question so that we go answer your question. But remember, we not dey prescribe for here. All wetin we dey do is just to educate you and to give you idea of wetin you think, wetin dey happen around you, and how to take give yourself a good health, make you for not enter the hand of quack. Dr. Fred. Okay, you say you do stool culture and he said it's resistant. When you do stool culture, it cannot just tell you that it's resistant. Stool culture will tell you which bacteria or whatever they see for the stool. And when it tell you, it go tell you the drug when you dey resistant to, and also the one when you not dey resistant to. So if you take that result to the hospital, if your doctor really see you,
Very good.
e go give you the ones wey you no
Okay.
dey resistant to. And you should know say most of the drug wey we dey use, some of the resistant, some of the sensitivity tests wey we dey do, when we dey try to find sensitivity to any antibiotics, some of the antibiotics no dey complete. So, and if e not complete, we can actually be thinking that it's resistant to everything, whereas it's not really resistant to everything. So I go advise that one, I don't think you have typhoid, and two, try go see your doctor or see another doctor. Dr. Fred, are you back?
Yes, so no vex. I don't come back. No vex. No vex. Sorry.
I
Now
know, no
NEPA,
problem. I know vex.
they show all shege. Now let's take some more questions because of time. Let's see your questions, Charles. Your question on the show. Okay. Good evening. There is a parent, both are AS, and they gave birth to one child, but that child gave up. But they didn't do genotype for that baby before the child gave up. Please, can the parents still stay together or they should separate? Dr. Israel, please respond.
No be me go put, no be me, they say what God has joined together, let no man put asunder. No be me go put asunder. Before they marry, I believe if they've gone to church, they must have done this genotype, this testing things, and the test don't already show, say there be AS, and they still decide to go for the marriage. So whatever they see or whatever they experience, they will bear it. Because when they marry, they say it's for better, for worst. So as far as for better, for worst, I think they should bear it and pray to God, make God help them. That's the best I can say on that. They can actually go and seek a counsel from psychologists, and maybe with that, the psychologist can actually tell them what to do. But they should get ready that they can still give birth to SS, sickle cell children, as far both of them as AS, and they can still give birth to sickle cell children. That I think that's the best I can say. Not be my mouth, you go for years say made them separate. I not go fit talk. I not go fit talk that one. You know, the only time I would have been able to say that it is when they never marry. But as far they don't marry, sorry, they not fit separate.
Yeah, thank you so much, Dr. Israel. I like that answer. Let's go to the next one. Okay, does staphylococcus cause chest pain? What are the symptoms? Oh my God. Dr. Israel, I beg, over to you.
No, Dr. Fred, answer that one.
Now, listen carefully again. Listen carefully. Um, when somebody say I dey get chest pain, we not dey consider staphylococcus because wetin dey cause chest pain, staphylococcus no dey on the list. Do you understand? So if you say you dey get chest pain, No doctor will tell you say the cause of your chest pain na staphylococcus. No, there are other things we need to look out for. But if somebody true can't get a medical condition caused by staphylococcus, among the plenty symptoms wey the person fit get, especially if the person gets wetin we dey call septicemia from staphylococcus, e fit get chest pain. But that does not mean when somebody get chest pain, we can't talk say the person gets staphylococcus. Capital no. Again, one final comment on this. When people talk say I get staphylococcus, we dey always ask them, who dey make this diagnosis for you? Na you dey diagnose yourself? Na lab dey diagnose you? Abi na your doctor for hospital? Because most times people no dey get this diagnosis from hospital. Na them dey diagnose themselves, which is quite very wrong. So if you dey get chest pain, abeg see doctor make dem confirm your diagnosis, and not staphylococcus. We have a comment here. It says, Doctor, what can cause skin body problem from Evelyn?
Skin body problem. Yeah, what can cause skin body problem? So when we say skin body problem, many things can cause skin problem. Let's remove the body, skin. Many things can cause skin problem, ranging from fungal infection, viral infection, bacterial infection to allergy. And these can actually cause skin problems. So when we say allergy, it means say your body you dey allergic to some certain things. Sometimes the cloth you wear, sometimes the food you eat, sometimes the environment, even the water you use to bathe, you can actually react to them. And when you react to them, you go either dey get skin rash or rash, or your body go dey itch you, or you go get some skin rash. So if some fit be, as I said, some fit be bacterial infection or fungal infection. All those ones go give you rashes. Even viral infection like Fredostar, all those ones will give you rashes. So now for you to see a dermatologist, doctors wey specialize in skin, they will actually know which of them, and they will treat you. Remember is that one thing you go know is that most of these skin rashes or skin infection, they are mainly fungal, and fungal dey very difficult to treat. So e dey take a longer period to treat any skin infection. Apart from all those things wey I mention, some cream when you dey rub can also give you some kind of reaction in your skin and can cause skin problem. They can even lead even to the extent of giving you skin cancer. So it is good to help our skin, give our skin the best. And the best thing you can even use to rub your skin is just baby Vaseline. When you use baby Vaseline to rub your skin, know when your skin dey react to water, and do the needful. Either you change the water, or you add some antiseptic inside the water, so that can actually help. Some people, if they bath with cold water, they go get itching and rashes. So what I advise most of the time, you can use warm water. So when you use warm water, you just notice that the rashes don't come out. So these are just some few things I can say about that skin
Yeah,
problem.
thank you so much, Dr. Israel. Before I take the next question here, you wey dey watch me, we never share. Why? But yeah, click on the share. The more you share, the more you are supporting us. But if you are not sharing, then I don't know why you will come dey make us dey suffer here. So share this live session. Now we have one question here. It says, Doctor, can sickle cell disease be cured? Is sickle cell disease curable?
Okay, and the answer is yes. Sickle cell disease can be cured, but the way it can be cured is expensive, and it's very expensive. It's very expensive. Let me just leave it that way. It's very expensive, and the procedure not be easy thing. And it's a transplant. It's a transplant. You go remove and replace. And so doing all those things, you will be able to cure it. But how many people get that money to take go pass through that process? How many strength? How often do you think that surgery can be done? So that's why it is better to prevent it than to think of the cure. So we now make we dey say prevention is better and is cheaper than cure in this case. So as I said, it's curable, but prevention is still the best. It's still the best because the process of being cured e dey very very difficult and very very expensive.
Thank you, Dr. Israel. Okay. Doctor, sometimes I do feel severe pain in my back and it makes me hard to breathe when it happens.
So if you get that kind pain make you hard to breathe, abeg go hospital. No be everything we go dey try to dey solve for here. Just go hospital. You never can tell what that pain is. It can be that it's affecting you, maybe it's your lungs that's been affected. I know some people when they get some kind of it still depends on the kind of pain. So when we not to just tell us these two things, I will just give you a diagnosis. It's not done that way. So now make we advise say you go hospital because it don't involve breathlessness. Once it don't involve breathlessness, anything can happen. So you need to go to hospital, make them find out every other symptoms when you dey get, do some investigation for you, and then give you the best treatment that you should need. Dr. Fred.
Thank you, Dr. Israel. Yes, yes, I see you. We have a question here. It says, what causes vaginal dryness? Sandra is asking this question.
Okay, to get sometimes if you like say natural, yeah. Some people are normally like that. The fluid then you need to the secretion from the kwekus, you need to play with them so well before e go start to dey come out small small. While some people that's why there's the use of lubricant. So in some cases it can be that, some cases it can be that you are already close to your menopause. So menopausal ages, people on their menopause they can also actually have dry kpekus. Also they get some medication when you dey use concerning your hormones, it can also cause dryness. Apart from okay, let me just take medication. Apart from medication you use for your hormones, some other medication that you use to treat some other disease can actually still cause dryness in that area. Then some infections can actually still cause it as well.
Yeah, thank you so much, Dr. Israel. I did check the questions, hoping that I no miss anybody questions because some people they say, see my question. I'm not seeing your questions though. Okay, this one says, hey, anytime I use cream, I'll be feeling hot and my left stomach used to pain me. This question is from Charles Moses.
So most of the time when people ask this kind of question, I only tell them that you already have the solution to your problem. The
Hmm.
solution to your problem started from first two words. Anytime I use cream. So
Hmm.
what it means is that you already know wetin dey cause your problem. So what are you supposed to do? You stop to dey use cream. There's no where it is written that you must use cream in this world. There's no where it is written. E no mean say whether you use cream or you no use cream your skin go change. E no go change. Na who you be, e depend on wetin you eat and your environment and how you relax. That's what make your skin what it will be. No be it's not 100% cream. So even as I dey talk to you, me I no dey rub cream. I cannot even remember the last time I rub cream because the weather is hot. Where I am the weather is hot. If I use cream all my body go dey burn me. So I stop using it and I've been living like that. So my brother, leave cream alone, so that you no go dey get hotness and your belle no go dey pain you again. And just leave cream and live happy. As far you already know say anytime you use cream, now you dey get those problems.
Yeah. Thank you very much. Now, if you just dey come, today's program now question and answer session. So we dey take questions tonight. Any question you get, as long as we feel advise you, but we know they treat, we know they give medicines here because here no be hospital, especially people where they find us to prescribe medicines for them. No. We are very, very professional here, but we can advise you so that you don't joke with your health. Again, we know they give number, we know they private chat anybody. Our job here now to answer you here and disappear. No vex. Thank you very much. We have a question from Mr. Amplify. Good evening. I dey get pain for my belle anytime I make love with my partner. I be man oh. Hmm.
Okay, if you dey get pain for your belle anytime you make love with your partner, um, I go just advise that you see your doctor. Eh? And the reason because we never can tell why you dey get that pain for your belle. And need to want to do some investigation for you. And also, I wan find out when you dey make love with your partner, when e reach that time when you need to release, you dey release, e dey come out or e no dey come out, because sometimes some people wey dey get problem like this can be say e no dey come out but e dey enter inside their body, so dem fit come start to dey get some
Hmm.
kind of pain and all that. So we
Hmm.
need to also know that. But all these questions na make I say there are some questions no be here dem go fit ask you. You need to ask the doctors, your doctors need to know and all that. And sometimes if you still get some kind of infection, you may be having those kind of pain. No, not only when you don meet finish, e fit be say even during the period when you dey meet sef, you fit just still dey feel the stomach pain. So you need to find out and see your doctor so that they can do some investigation for you and give you medication if there is any need to give you medication, or tell you to do some exercise that can actually help you.
Yeah, thank you so much, Dr. Israel. Because if you dey listen to us, you get some questions wey we dey ask you. Those questions they very important, and these are things that we cannot be discussing with you on the live session, where you go need to discuss with your doctor to know more, because dey normal for a man to meet partner, you can't dey feel pain. You understand? And for some people, something fit dey go on for their body, they no go hospital. Now when you don't come go very, very far, at that time they'll come enter hospital, which is not good. Huh? Okay, let's see. And they try check. Okay, I don't understand this question, but I go read them. It says, my question be say, how can person that is diagnosed and doctor said she have leaky brain blood vessels, how can the person recover? Is that what you were asking? Chronic subdural hemorrhage. Hmm.
If person get chronic subdural hemorrhage, wetin e mean? E mean say blood dey leak enter some part of the brain. So that person need to see a neurologist, people wey dey specialize in the brain. So they may even
Neurosurgeon.
depends.
Neurosurgeon.
Yes, they are surgeons. They may even want to do, they go first do scan for the brain, CT scan, MRIs, they'll do one for the brain and see how much that hemorrhage be, that blood wey dey the brain. If it's very much, they may want to drain it. If it's very tiny, they may just give conservative
Hmm.
management. When I mean conservative management, just leave am make we see e go by itself dry off. But as dem dey do that one, they will place am on medications and some other things wey dem go tell am make e dey do, and some things wey e go even still avoid. So those are the only things. And once dem don diagnose that, please, na neurology, no be any doctor. That is doctor wey dey specialize in the brain, and dem be surgeon. Na you go need to dey see, because that hemorrhage fit alter a lot of things for that person body, as far na the brain e dey. Dr. Fred.
Okay. Let's take some more questions. We have how many more minutes? We have about 15 minutes left. Okay. Doctor, what causes, yes, did you hear me, Abby?
Yes.
What causes palpitation of the heart when the heart beat faster than usual?
When the heart beats faster than usual, that's what is palpitation. So the heart dey beat pass usual. That's and palpitation na when you dey hear your heart beat. If the hear am dey make kpum 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 kpum, na im be palpitation. And if the heart is beating faster than usual, it will actually make you to dey hear your heartbeat, and that will actually give you, that is palpitation. That is palpitation. So if you do exercise, e can cause that one. If you get anxiety disorder, you hear a news that make you shock, e can actually give you that. When you dey fear, you hear one kind strong sound and you are afraid, you go notice say some people mind go fly and their heart go dey beat boom boom, they go dey hear am. So if you get some kind of heart diseases, heart condition, you fit still dey hear your heart dey beat, and your heart fit dey beat more than normal. And if you don dey get heart failure already, maybe you don dey get heart failure, your heart go dey beat more than normal because e dey try to pump blood to every part of the body when e no fit, and at that point you fit still dey get palpitation. So these are na some of the things wey fit cause am, and there are so many other things, even to the ex ten t of anything wey happen to your lungs and all that. Dey fit even still cause you to get your heart to dey beat fast, and then palpitation can also be noticed as well. Okay, another question wey dey here na, make I just follow based on the question wey I dey see here, is woman wey no see menstruation dey see ovulation. Now, before menstruation start, before menstruation comes ovulation. So na ovulation dey start, dem dey first see before menstruation, because na the ovulation na im dey cause menstruation. However, when the person just first start to dey see menses, that is menarche, when you just new enter start to dey see menses, na menses go just first come out. But after that, na make e be say some women wey don born finish, wey don born, before dem know wetin dey happen, dem don get belle, and some of dem no even see their menses. It is because ovulation don first come before menses. So egg go don release. Now when that egg wey e release is not fertilized by any sperm, na im menstruation dey come happen. So if that egg is fertilized, menstruation no go occur. So use pregnant women wey just new give birth, use dem as a case study. You go see say some of dem dey get belle even before dey see another of their menses. This one na because, yes, ovulation can be seen before menstruation. And sometimes you hear your doctor will tell you, you dey look for pikin. For most people wey dey look for pikin and dem no dey see their menses, the doctor say, okay, no problem. When e reach time, they will give you some medication to prepare your womb. And one of the things when dem dey prepare na one of the things when dem dey prepare na to prepare so that your ovulation go come. And once your ovulation come, you go get pregnant, and most of the time you may not even see your menses. I hope say I fit answer that question. If you dey lis ten to us, we still dey on air, and this is Ask the Doctor. Today na question and answer session na we dey do. Dr. Fred, welcome back.
Yeah, thank you very much. Next.
Okay, and Dr. Fred don still comot. E be like say network dey disturb am, or e dey disturb us. Okay. Another question I dey see here from Adewumi says, please, doctor, can AS marry AS? I go give you two answers, yes or no. Yes, one answer na yes, the other answer na no. Now, make I tell you for the yes. For the yes, if you know say you are not ready to give birth to a child, you can get married. As AS wan marry AS, you can get married. If you know say you no wan born by yourself, you wan adopt pikin, no problem. If you know say you wan just get married for companion sake, so that you get companion, no problem, you can actually get married. But if you wan born pikin by yourself, I will advise say make as an AS no marry AS. That na the no part. As an AS no marry AS. If you wan give birth by yourself, This one na to prevent your children make dem not become SS, because in the problem that comes with having SS is more than the love wey you think say you get. It's more than the love wey you think say you get. So I think I will advise well that abeg, if you be AS and you wan marry AS and you think say you wan get children, abeg no enter dat marriage, no do there. But if you say you wan just marry because of companionship and you get your own pikin, the woman get your own pikin, una wan just dey together, no be to give birth, no problem, you can actually do that. We know say you go say test no dey to take check whether the pikin na SS for belle. If you check am say na SS for belle, wetin you wan do? Remember say for Nigeria, abortion na illegal thing. So wetin you wan do? Dat na another question wey you go ask yourself. And okay, let's assume say you even dey country wey yes, abortion is legalized. You wan go dey remove the pikin every time? How many you wan remove before you come know say na AA or AS na you wan get? So it is better you avoid all these problems. It is better you avoid all these problems because the money to even do the test is not cheap, it's so expensive. So it is better we avoid all these problems than to put ourselves for problem when tomorrow we go come dey cry say I don know. So you know now, if you know say you wan get your pikin, abeg AS, no marry AS, go find AA marry. But if you know say na for companionship and you just wan dey together, no problem. Abeg, if you dey hear me, just write on this comment section say you can hear me. And also remember, try share this live session, so that other people go learn wetin you don learn, because dat na one way when you go fit dey support us. Share and like our page. These are na just the ways you can support us. These are the ways you can make our page go far, and otherwise. Dr. Fred still dey get small network issue, but I think it will still, he go soon join us soon. So before he join us, we go still continue to answer the questions that are on screen, the ones when I dey see. So if I no answer your question, know say maybe I no see your questions. Please, doctor, is it good to drink hot water? To drink hot water is very cold here. Drinking water is very difficult right now. Thank you. Any water wey you know say you go drink and e dey okay for you, you are free to drink it. After all, dem dey drink hot tea. If you can drink hot tea, why can't you drink hot water? But it does not matter. The water must not be too hot, so I mean you not burn your mouth and burn yourself. So because you can take warm water, lukewarm water that is not too hot. Yeah, that is what I can say. Doctor, please elaborate on rhesus blood group, mostly especially on O positive and O negative. Dr. Fred, are you back? Okay, for rhesus positive and rhesus negative, for rhesus blood group, is that na another way when we take dey look our blood group. We get the ABO blood group and the rhesus way to classify our blood. And so most people you go either when you go do test, they go put either you get A, B or O, they go come put sign on top, either minus or plus. So that minus and plus na be the rhesus for inside. So if you are O negative, that's fine. It means say you can donate to everybody. You can donate to everybody and also yourself. If you be O positive, that's also beautiful. You can donate to everybody, but the thing is that you cannot donate to O negative. But O negative fit donate to you, but you not go fit donate to O negative. In only some rare condition, you may want to donate to O negative. But after the donation, they will likely give the O negative some medication so that may nothing really happen to them. The reason is just because of that plus and negative minus when they are above. So another thing when this rhesus take on dey important, now when you can't get belle, if the woman na rhesus negative and the husband na rhesus positive. So if you can't get belle, you need to also be very careful. because yes, your first pregnancy may be safe, but now that first pregnancy now they cause the problem for every other pregnancy, because when you born that first pikin, the body goes dey sensitized. That is, you can't know say yes, one factor dey here wey not suppose dey here, which is the positive blood. Mostly if the pikin blood go collect the papa rhesus positive. So if that one happen, no say wahala dey ground. But to solve this wahala, e get one drug when they give, one injection when they give, when you need to take within 72 hours. So when you take that injection go cancel the wahala when dey ground. So that when you get belle again, your pikin go fit come out alive. However, if you not take that injection and your blood already produce antibody against rhesus positive, if you can't get belle again and the pikin still carry rhesus positive, your antibodies, your soldier wey dey body go fight with the pikin blood, and sometimes and kill them, to the extent say when you come born, the pikin go come dey come out as stillbirth, pikin wey go don die before they come out. Or sometimes the pikin go come get na only water go dey their body, so there will be like one kind thing, and they no dey always live long before they go die. In fact, as you dey born them, some hours or minutes they go don die. However, if you be rhesus negative, your husband na rhesus negative, there is no problem. If you be rhesus positive, your husband na rhesus negative, there's still no problem. Now only if the mother be rhesus negative and the father be rhesus positive, na small issue dey. But with the help of that injection, that can be solved. However, that injection still dey very expensive, but it not be something wey go fit say make people not get married. So we still dey on here, and just to let you know, say we go soon close, because time is already fast spent. We just get less than 3 minutes to spend with everybody for here. But before we go, I go also want to remind us, make we try and share this live session so that people go learn, like our pages, and follow us. It is also very important that you follow us. If you never share, please share. Hmm? So, what is the reason why this? Okay, this question say, what is the reason why they said sickle cell patients should not take iron? Because iron is not really what they need in their body. Iron is not what they really need, and if they get too much iron, it go still cause a lot of problem for them. So they need more of vitamin B, cove, and folic acid. Those are still part of the things that can help them produce more blood for their system, because their body already contain a lot of iron. So it is better that you get other factors that the body really needs, instead of adding what the body already has. But is there any issue when O positive and O negative get married? There is no issue. They can actually get married. But I only don't specify the only thing they will need to do. Only if the woman is O negative, they will need to always get those injection anytime the woman is pregnant. Mostly when the woman don't give birth, 72 hours after the woman don't deliver. Also note this: if this woman don't first miscarried or had abortion, in that shows that woman fit don dey sensitized already. So it means that when the woman is pregnant, you need to let the doctor know, so that they can actually give this injection even before delivering. So our time don't go. So I will just try. There are some questions I may not answer, but if I if I if I have the time, if I see them, I go answer. As I said, now only questions when I dey see, now I go put mouth. Now I go chook mouth as we wait for Dr. Fred to join us, because our time is already fast spent. If you still dey hear me, just write put say you dey hear me. And if you dey understand or wetin we dey talk, still write say you dey understand. And if we answer your question and you think you are satisfied that yes, we have answered your question, still write say yes, we answered your question. And as you dey do this, try share, and as I also say, try follow our page. Okay, this question is saying, please, kidney stone, can a kidney stone of size 7.2 millimeter lodge in the mid callus of the kidney pass on its own? It doesn't cause any symptom. Now the way wey you take explain even where the kidney stone dey, it make me laugh and it make me dey try to wonder if you are also a medical person. So if you are a medical person, I think you will be able to answer that question. But with a lot of fluid, if you take a lot of fluid, anything is possible. It may actually be able to pass out on its own. And also, if e no dey give you any pain, e no dey give you any symptoms, any problem, with time, e go pass out on its own, mostly if you dey take a lot of fluid. So even though e no come out once, I mean, because of the lot of fluid that you are taking, it can actually dissolve gradually and go dey come out small, small. But if it take a longer time, but don't worry, it go always come out. Okay, somebody dey ask, what are acid reflux symptoms and its complication if left untreated? So acid reflux, when we say acid reflux, e mean say the acid wey dey the stomach dey come out, dey try to dey enter the esophagus and all that. And one of the thing wey e go cause burn, because the esophagus, the lining of the esophagus no get that thickness wey the stomach get, wey go protect am from wey dey protect the stomach when the stomach no take burn. And the lining of the stomach is thick, and na so God take create am, so that even with the acid wey dey within the stomach no go fit burn am. But when you dey get this reflux, it mean say e dey enter your esophagus and dey try wan come out. E dey pass there, and because of that, and the esophagus no get that same thick lining as the stomach. So what will it cause? It will cause burns. You know wetin acid be? E go cause burns, and these burns, and these burns, na go sometimes lead to all this when the people they get peptic and they get ulcer pain. So it cause injury. E go cause injury for there. So e go be like say e give this person ulcer pain. So e go give you all the symptoms when ulcer they give person. So if you leave it untreated, if this burn continue, it can lead to perforation, and any other thing can follow. But it is good to treat yourself when you notice things like this. Treat yourself so that you can live happily. So I don't know if una still dey hear me. If you still dey hear me, you just let me know that you dey hear me. But however, we don't come to the last minute of our program. In fact, we don't even pass the time when we dey spend. We've spent an hour and 3 minutes. Normally, this program are just for 1 hour, and after that 1 hour, we go end the live session. The reason why I still dey here small, I just dey use the opportunity to see if Dr. Fred go still fit come back online, so that we go talk